Well, good afternoon, good morning, good evening, whenever it is you're actually watching this. This is a presentation done by myself, Adam Rene, and
Avolese.
we are going to be presenting on looking at the differences between and the similarities between the LMHC, the LICSW, and the PhD&PsyD degrees. So first off, what is an LMHC? Well, it's the best and most important degree that anyone can get ever and forever. Assumption is the best and only place that you should get your degree. And lastly, there is this amazing professor whose name is Dr. Adam Avolese, who literally wrote the book on how you should facilitate CBT treatment. And you should buy it on Amazon. But I wanted to make something clear. You should get the hardcover version because it's better. No questions. Okay, but really, what is an LMHC? Well, LMHC stands for Licensed Mental Health Counselor. The LMHC is meant for someone who has a specific interest in mental health and mental illness. LMHCs have a broad knowledge of mental illnesses and treatments. And interestingly, the LMHC can treat individuals, they can treat families, they can treat couples, and they can also treat groups. So there are several course requirements regarded to the LMHC. LMHCs are taught in counseling theory. They are also taught in human growth and development. They cover psychopathology. They cover social and cultural foundations. There's a large focus on clinical skills and clinical skill building. There's also a focus on group therapy and group work. They also cover very special treatment issues. They talk about the theory of appraisal and how that works into the therapeutic process. There's also a component on research and evaluation, understanding the purpose and validity of research articles and empirical research data and how that informs treatment. And lastly, an overall professional orientation into the workplace and into what kind of jobs and opportunities that the LMHC can have. So let's talk about licensure requirements. So the first round is attending a 60 graduate program credit hours. So there has to be 60 credits that are earned in order to complete the LMHC degree. Then there are also graduate program counseling hours, and those are related to direct client contact as well as supervision under a licensed supervisor. So for the Assumptions program, there are 100 hours that need to be completed for the practicum experience, which comes first. And then there are 600 hours for the internship experience, which takes place over 2 semesters. And there are certain directives around direct client contact. So in this case, we have here 280 hours for direct client contact, and then as well as a designation for 70 hours for supervision. Afterwards, after completing your degree, after getting that 60 credit hours, completing the practicum and internship, there comes several thousands of hours of postgraduate work. And that comes out to around 3,360 hours. So approximately 2 years of practicing under the license of your supervisor before you can obtain your own license. And this comes out to around 960 hours of direct client contact, so billable client direct work, and then as well as 130 hours of supervision under an LMHC. Afterwards, after these specifications are completed, there needs to be the exam, the counseling exam that is either a pass-fail, and upon successful completion of this exam, you will be eligible for your license and will be able to practice independently, if you so choose. You can still stay at an agency, you can still work, you can even work in a supervisory role with an LMHC license. And then, but it doesn't stop there. The learning doesn't stop after the license happens. There's always new theories, new strategies, new interventions that come out. And it's important as well. And as our community and our culture grows, it's important to stay up to date on the comings and goings of these new things. So there are continuing education expectations. Every 2 years, in order to maintain that license for the LMHC, 30 CEUs are mandated every 2 years to be maintained. And those are done through trainings and different training programs that can be offered through your agency. They can also be offered by your alma mater. And this is in order to maintain current knowledge and current discipline, and showing the ever-growing nature of the counseling profession, that it's not one that just is a designed set of skills and then never changes. It's something that needs to be grown and cultivated over time. So there are several job opportunities that an LMHC can have. One is substance abuse counseling, another is family therapy, also individual therapy. As I said before, a clinical supervisor position. You can also work as a residential clinician in a residential home setting, a behavioral health clinician, a geriatric counselor working with the elderly. You can also work as an employee assistance program counselor, so someone who works through a major agency or company to offer therapy services for employees, and as well as working for a military personnel counselor, so someone working with veterans or active military. So after hearing all this with the LMHC, what is social work? So according to the sources that Paul and I found, social work really targets individuals who care about diversity, equality, and social justice. There is a heavy focus on increasing quality of life, and a social worker must practice under an LICSW, so a social worker, clinical social worker who is licensed. So now that I mentioned clinical social worker, what is a clinical social worker? Well, a clinical social worker is the only type of social work degree that can assess, diagnose, and treat psychosocial illness. So there's a large difference between the social work degree and a clinical social work degree. LICSWs can provide general counseling, and they also can practice independently or collaborate with other professionals. So here are the various course requirements for a LICSW. LICSWs practice or learn rather in ecological systems theory. They also learn about human development. They also cover sociocultural theory. They talk about psychodynamic theory. They also talked about cognitive behavioral theory. They also cover solution-focused theory. And lastly, they do discuss motivational interviewing. So what are the licensing requirements for a clinical social worker? First off, a clinical social worker must obtain a master's degree from a social worker accredited program, and there are several in Massachusetts. They must also engage in field education, which, if we're talking about LMHC terms, is the practicum and internship side of things. So they first must spend 10 hours a week in a lab experience, so kind of like the LICSW version of a practicum. And then once that's completed over the course of a semester, they are then expected to attend 24 hours a week in a field placement for several semesters in order to acquire those hours in the field and get that field experience. So after the degree is obtained from that accredited program, they then have to engage in 3,500 hours approximately of supervised postgraduate work. And in my research for the LICSW, I couldn't find defined numbers on direct client contact, if there is any specification around that, but they did specifically mention that there needs to be about 100 hours of supervision. So meeting with somebody, a supervised LICSW, someone who already has their license, for about 100 hours during that time. And that again comes out to about 2 years. So the same kind of time frame as the LMHC. They then must complete and successfully pass the ASWB clinical social worker exam. And again, we see a similarity here. 30 CEUs every 2 years in order to maintain their license. They need to also be continually engaging in new content, new trainings, new ways of doing the work. So there are several job opportunities for someone who has an LICSW. So the LICSW is someone who can work in a school. This is someone who can work as a substance abuse treatment center. They can work in a hospital. They can work in college counseling centers. They can work in day treatment programs. They can work in mental health clinics, outpatient facilities, psychiatric hospitals, private practices, court clinics, prisons and jails, and also legislative advocacy divisions of certain institutions. So what is the differences or the similarities between the LMHC and the LICSW? Well, the first thing that we noticed was looking at the course requirements. So an LMHC, with regard to its course requirements, seems much more specific to clinical practice, to a certain kind of theory, especially with assumption. This is a cognitive behavioral therapy program. And so that is the place of study. Versus LICSW is much more broad. It's much more kind of throwing a bunch of things at the wall and seeing what sticks. There's a big exposure to different theories, whether it comes to systems and culture and diversity and all these things. The next thing we wanted to look into was the similarities and differences in licensing requirements. We both saw very similar CEU expectations for LICSW. It's 30 CEUs every 2 years. Interestingly, if you only go for a social work degree instead of a clinical social work degree, it's actually 20 CEUs every 2 years. And we also noticed some similarities in the postgraduate hours. The LICSW seems to have a bit more hours, but less specified on what those hours are supposed to go towards, whereas the LMHC has specific expectations around direct client contact and then supervision. And then lastly, the job opportunities. The job opportunities for an LICSW seems to cast a wide net. It gives you a wide net of opportunities to work in a lot of different areas. And even for myself, and maybe for others in this class, when I was considering my LMHC, I worked with a bunch of LICSWs and they were all like, no, go for LICSW. You're going to have better job opportunities. You're going to have more to pick from. But for me, I knew what I wanted. I knew I wanted to be a counselor. I knew I wanted to be a therapist. And that's the job opportunities that I wanted. So that's why I went LMHC, but sidetrack. Anyways, the job opportunities for an LMHC are a bit more specialized. They're a bit more focused on the counseling practice. And so those are more outpatient clinicians, family clinicians, in-home therapy, substance abuse. I know we saw there were some overlap in some of the job opportunities, but wider net versus something that's more specialized. And so we did want to pose this question. Now that you have heard about the course requirements, the job opportunities, and the licensing requirements for the LICSW, as well as for the LMHC, what are your thoughts about getting an LMHC now versus an LICSW? Does the wealth of job opportunities interest you? For an LICSW, is it the course requirement? Does the course requirements around LICSW seem more interesting to you? Is it more, do you have more of a passion for systems and culture and diversity? Not that LMHC doesn't cover these topics, but is that something that's more important to you, that you want to work on those kind of social change? Or is it more the specific counseling, working one-on-one or with the family that comes with the LMHC? So food for thought.
All right, so now we're going to get into the doctoral degrees. Basically, the main difference between the PhD and the PsyD, and we'll go into more detail as we go through the slideshow, compared to the CSW or LICSW and LMHC, is these are doctoral degrees. They're a little more intensive. They're going to take a few more years to complete, but you come out having a stronger skill set in certain ways. And we'll go over specifically what that is as we go through the slideshow. So starting with the PhD, this type of degree can be obtained at a public or research university rather than a professional school of psychology. You'll get rigorous research training designed to prepare for a career in academia or research, or practice as a licensed clinical psychologist. The program covers many different aspects of psychology, including perception, cognition, neuroscience, and behavior. And there's more of that research focus. Courses cover qualitative and quantitative research theories and methodologies. And This degree can be completed in as little as 4 years if a master degree in a related field has been obtained, or at least 5 years if entering the program with a bachelor's degree. Commonly, it takes between 5 and 7 years to complete the degree for everyone else. All right, next slide. Um, so when we're engaging in the PhD program in our first year through our third or fourth years, we focus more on that theory, the research, statistics. Again, the total time to complete depends on past experience with schooling. And then in that final year, you're devoted to your independent research program and writing of that final dissertation. Next slide. These are the general courses that are common in PhD programs. You're going to be, you might notice they're very similar to the master's degree programs, but they're going to be more rigorous and intensive. So your research methods class, you might go a little more in depth in certain ways and learn how to utilize certain methods in ways that you might not in that master's degree program. Got foundations of cognition, affective science, developmental, statistics, perception and reality, psychopathology, advances in neuroscience, attitudes and social judgment, and advanced statistical modeling. So some of these courses we do see in those master's programs, but things like perception and reality, advances in neuroscience, those are a little more intensive than maybe some of the things that we do discuss in those master's level programs. With the PhD, there are similar job opportunities, but there are also more academic focused ones as well. So, there's the academic researcher position. A lot of people might be engaging in, fellowships, things like that in the master's program, but this is more of like a full-time paid position where you're getting paid to do that research. Similarly, you can become a professor as well and teach courses, master's level courses in psychology. There's the clinical practice that's similar to the work with that you would be able to do with a master's degree, but maybe you might have more of a supervisor role, you might have more authority at your organization, and pay bump as well having that PhD. There's independent consulting, industrial organizational work, laboratory manager. So again, laboratory similar to academic research, doing research at a university or in a setting that seeks to advance the field of psychology. Neuroscience work, policy advising, school psychologist, which again is similar to the work that you can get from a master's degree, and user experience designer as well. All right, so that's PhD. So now moving on to PsyD. The biggest difference between the PsyD and the PhD, Adam puts it really well. PsyD, you're a consumer of research, whereas a PhD, you're kind of doing the legwork, getting that research, and putting together what an individual with a PsyD might try to practice more. This degree is obtained in professional schools of psychology rather than the public or research universities. And it's an applied doctorate designed to prepare individuals for direct practice, a direct practice career as a licensed psychologist, rather than that career in academia. We're doing that research, teaching things like that. There is that option to specialize in specific types of therapies or populations as well. Usually when someone goes into a program, professors will teach from their specialty, their background, their degree background, and it's up to students more so to develop their own sense of the kind of clinician that they want to be based on everything that they learn from these different backgrounds. So course requirements, kind of similar to PhD, kind of different. The first year courses do have those foundational theories of human behavior, psychology, and then there's also that formation of a professional identity as a psychologist. So really learning the direction that you want to go as an individual. It's less about teaching you the role of the psychologist. It's more about teaching you the skills so that you can utilize them for yourself. In that second year, the clinical techniques and skills are taught using assessment, interviewing, things like that. And in your third year, you have specialized knowledge of various theories and interventions relevant to your career goals. So again, you kind of see that building process as you're going through this program and creating your own professional identity. And in that fourth year, you're going to be applying all that with your full-time internship and a completion of a research dissertation as well. Next slide. So course requirements. Again, so a lot of similarities between this and the master's level degrees, but more intensive again. So, excuse me, you have your psychological theory and foundations, biological foundations of human behavior, your ethics, statistics, cognitive assessments, behavioral assessments, which is pretty cool that, they have these two specialties for cognitive and behavioral assessments, clinical interviewing, advanced psychodynamic theory. So again, more intensive, more in depth to a lot of concepts, child development and psychopathology, and then that practicum internship as well. And for job opportunities, these are probably more closely aligned with the LMHC and the LICSW compared to the PhD because they are more applicable and more applicable in terms of carrying out more of a professional application of the skills that you learn versus the PhD that's more research focused again and more focused in academia. So we have the addictions counseling role, applied researcher, interestingly enough, clinical psychology, government researcher, industrial organizational psychologist, marriage and family therapist, mental health clinician, professional consulting, school psychologist, and sports psychology as well. And now for our licensing requirements, PhD and PsyD, they overlap in this respect. You'll notice the hours are somewhat similar, but the expectations are different because, again, it is that more advanced degree. So you have the 3,200 hours of supervision. Half of this is during your internship, half of it is postdoctorate. And during this time, you take on, again, more responsibilities in your role. Maybe you'll have some supervising responsibilities as well, but you'll be receiving supervision for the supervision that you give, that sort of thing. And then to get licensed, you do need to complete an application involving college transcripts, references, background check, and an application fee because you can't get a degree for free. Then you have your exam as well, the National Examination for Professional Practice in Psychology, and as well as the Massachusetts Jurisprudence exam. These must be completed within 3 years of your initial receipt of approval to take the exam. So after you submit that application, you get the approval, you have 3 years to take them. And if you do not pass, then you must wait 3 months before taking the exams again. And passing scores are 500 out of 800 for the EPPP and at least 70% for the jurisprudence. License renewal is required every 2 years, and 20 hours of CE credits are part of that as well.
Okay, thank you, Paul. And so we wanted to wrap things up by now that we have an understanding of PhD and PsyD, which honestly, the PhD PsyD of things was the most interesting to me because that's a degree that I have not even looked at. Like, I know I can speak for myself and my wife that when we finish end of April, we're no more school for us. Like we're all set. So this was not something that that I had even considered looking into. So, so when you look at the course requirements for LMHC versus PhD and PsyD, we did see a lot of similarities, and Paul pointed those out, that there are more, especially with the PsyD, there's more specific courses around theory and practice, and those, the cognitive assessments, the behavioral assessments, like those are really, really interesting. The practicum experience, the internship experience, that's all very, very similar. In terms of licensing requirements, the hours were in the range. They're pretty close. The hours expected for post licensure in the PhD and PsyD postgrad anyway, PhD/PsyD was very similar in terms of the amount of hours to the LMHC, and the CEUs were exactly the same. It was, or was it 20 or 30? Either way, it's the CEU's expectations very close in terms of the LMHC and the for the PhD and the PsyD. We also wanted to look at the similarities, differences in job opportunities. We did see a lot of similarities, especially for the PsyD and LMHC, in terms of, we saw a lot of overlap with certain types of counseling and certain jobs in counseling centers, community mental health, things like that. But obviously the big difference between job opportunities with the PhD is PhD really brings in that academia side of things and those opportunities to work as a professor or as a researcher. That is not something that LMHC can do. And so that was honestly probably one of the biggest major differences between those. And then lastly, to look at the differences between the LICSW versus the PhD and the PsyD. One thing that Paul and I noticed when it came to the course requirements is that the focus on different theories was very similar. So that kind of broad generalized look at different theories, different systems was very similar between the course requirements for the LICSW versus the PhD and the PsyD. The licensing requirements. So again, we're seeing a lot of overlap in terms of amount of hours expected for post-graduation. Similar range of hours needed, as well as similar CEU expectations. In terms of the job opportunities, again, a lot of overlap in terms of what we saw to be similar. But again, PhD, academia, that is just one area that the PhD really has unique to itself, is this whole opportunity to work as a college professor or as a professional researcher. That is not something that the LICSW can do. But again, a lot of similarities between the PsyD and the LICSW. So Paul, I'm going to go off book a little bit here. I wanted to get your thoughts. So doing this project, doing all this research, I know that you did a lot of research into the PhD, PsyD. Was there anything that really surprised you or stood out to you?
I would say probably the supervision and like the postgraduate sort of stuff. I think for me it stood out because we are in a master's program and I am getting all that experience now. Obviously, it is more rigorous in those advanced degrees, but just the thought of like pursuing one of those degrees and then having to do like another 3,200 hours of supervision just, really blew my mind. If I was coming in like straight to the doctoral program for a bachelor's, maybe it'd be different, but it's kind of surprising.
Yeah, because I know that you'd mentioned to me that you were considering a PsyD, correct?
Yeah, PsyD, that's what it's looking like right now. It might be PhD, it might be nothing, but we'll see. And it's a little late to apply now and just go straight from this program. So maybe after I have some experience, that 3,200 hours won't seem like such a big deal.
It's true. Yeah. Maybe you can wrap your head around, like, I have to do this all again.
Right.
Did doing the research for this assignment, did that kind of solidify that that's something that you want to do? Did it dissuade you? Did it not change? Like,
yeah, I would say it's kind of funny. I was speaking with my supervisor about this a few weeks ago because she has a PsyD and I'd been meaning to, and it kind of lined up nicely with the project to be able to do that. And just hearing her talk about that that intensive educational experience and especially for the PsyD, the idea of growing in your own professional identity through what you learn from these other professors just really appeals to me. So I think it's kind of pushing me more in that direction, but again, we'll see.
That's cool. That's cool. And yeah, so like I said, I work with predominantly LICSWs in my current workplace. And so I got to get some kind of like anecdotal information about the LICSW. I actually know some people who wish they went LMHC after getting their license in clinical social work. They kind of wish that they had gone, because I think those are the people that I've met who have more of a heart for the counseling side of things rather than the system side of things. So they like, oh, I wish I had, specialized in that so that I would have those opportunities would be more. And the schooling I got too. I wish that the schooling that I got was more specialized. So grass is always greener, I guess, in some ways. And but either way, this was a really interesting deep dive to do across the board.
Yeah, absolutely. I'm really glad that we had this topic and we had this opportunity.
Mm-hmm. Okay, well, our final questions to you all on the interwebs. So after hearing about the course requirements, the job opportunities, and the licensing requirements for the PhD now and the PsyD, what are your thoughts about getting an LMHC versus one of these doctorate degrees? Not to say that you have to, please don't abandon now and go for a PhD or a PsyD. Please finish your LMHC and then consider doing this. But does it make you think? Does it make you kind of go back and be like, maybe instead of going for the LMHC, maybe I should have dived into a PsyD or a PhD? Is it something like Paul, where you're going to finish your degree, you're going to do your time and then pursue that later? And then along the same lines, now knowing the understanding of the opportunities, the requirements, and licensing and everything for PhD and PsyD, how about the LICSW versus the PhD PsyD? Does the LICSW still seem interesting to you? Is it the PhD? Is it the PsyD? It's good to know. I know that we are all kind of invested in one degree right now, but it is good to know that there is a lot of overlap in terms of the expectations, but there are specifications in each. There is glimmers in each degree that are special to it and only it. And that is something that's really unique about this field and this program. And here are our references. And that's it from us. Paul, do you have anything else left that you wanted to say?
No, thanks for watching, and I hope you found this educational, everyone.
Yep. All right. And we'll see you all soon. All right. Thanks, everybody.